not saying people haven't died from it. I'm not. You know, this is what I'm saying is that there's nothing else exists. There's nothing else out there apart from COVID. So the thing is, what I'm struggling with is the effect. Am I allowed? Do you want me to start?
You're on your way. Carry on.
So I've been a nurse for 40 odd years, right? Now, we've tried for 40 years since I've been a nurse and long before that to try and stop people dying, right? But we can't. Okay, so it's a fact of life and death that people die. So what my big problem is the things that we cherished when I started nursing. So the values of nursing. So things like dignity, choice, compassion, empathy. The things that are really important to me have gone out the window. Now, for instance, so when I went back into nursing, because I thought, do you know what? My teaching's not going to last. I've got to work. I still had my PIN number. Yeah. So I was still working as a consultant as well and still doing the odd nursing procedure. But I didn't really want to be a nurse, but I thought I've got to earn some money. So there was a lot of adverts, if you remember, sort of early March, about come back to nursing. Nurses that have retired, come back into nursing. But there was no sort of entry for someone like me who was actually still on the register. So it took a while to get... I spoke to so many different people. I had emails, honestly, the amount of emails I had from different departments of NHS England. Well, anyway, eventually I got people contacting me. I had several different trusts contacted me. So I thought, right, OK, I'll do a bit of nursing. But I was only bank. I was only going to help as and when. And also, Nightingale, I'd registered with Pulse, who are a big agency. They were doing, I think it's Thomas's and Westminster. But I was going to go up to the Nightingale. So I did all the training, but I was never needed. So I thought, well, I've got to work. So I started at one of the trusts. That's 3 different trusts that I've worked for since March. So I started and I did end of life. And I was absolutely devastated. So, for instance, if I tell you my story that has upset me so much that I still can't really compose myself. So I had a 40-year-old man with sepsis. Now, sepsis was always the biggest killer at the moment. His limbs were black. He was in multi-organ failure. So I looked after him. I was his designated nurse for 2 long shifts. He died at the end of my second shift. So we were 13 hours with half an hour break with full PPE. And I was holding the iPad for him to say goodbye to his wife and children. And I still can't move on from that because that is, to me, criminal. They may catch COVID. I had the wife screaming at me, calling me a effing bitch because I wouldn't let him, it wasn't me. Anyway, since then she's apologised. It wasn't her fault and I totally understand. But why didn't they have the choice of letting them, if they wanted to catch COVID, why not let them be with that person at end of life? Yeah? So that was number one, and that upset me so much. And I said, well, I can't go back there unless you really look after and let them in, give us proper breaks, let the end of life have people with them. So I didn't go back to that trust. So I've actually caused a bit of a problem where I've been because I refuse to go back if they don't look after us. Because if we're not looked after, then how can we look after them? And dehydration, hot weather, it was early April. So then I tried a different trust. I have to be careful because there again I can't really name them, can I? So I'd had an end of life who was a COPD, so a respiratory chap. He was 67. Same thing happened. They wouldn't let his wife in to be with him, and I'm the last person to hold his hand. I'm a complete stranger. So I could do all the physical stuff. Of course I could. I'm used to end of life. I'm especially, that was not my forte, what do you say, but that was my speciality. So I did all the things, the physical care, but I couldn't emotionally support him how he should have been. Psychologically, what was going through his mind, because they say that hearing's the last thing to go. Now, he was more semi-conscious when I was trying to moisten his lips, do the mouth care, do his pressure area care, creaming his skin, all the things that physically I could do, but emotionally his wife should have been with him. And so that was that. So I thought, right, I can't do end of life anymore. So then I went to another trust on the bank, did the same training again. So I've done so much training online. I worked on a COVID ward as a bank nurse, not one COVID patient. So I thought, fine, I'm lucky. The nurses were so alien to me because obviously I'm older, I'm only bank. The masks present a communication problem. So I had a lady who was so distressed. She was 89. She pulled my mask down and stroked my face. And she said to me, life is not worth living. How many paracetamol will it take to finish me off? Because I can't carry on like this, not being with my family. So I went to the ward sister, who was probably about 28, 30. She looked at me as though I was a lump of... and said, what do you want me to do about it? And I said, well, can I please talk to the safeguarding team, who were not at work? But she said she'd send them an email, which I don't know if she ever had a response. And I then asked if I could phone somebody, and I was denied that because they're working from home. So I don't know if they ever answered, because bearing in mind I'm bank, so I wasn't actually belonging to that ward. So this lady... oh, and I got humiliated by the ward sister in front of all the staff, all the rest of the patients, because infection control, I had allowed this lady to stroke my face and I'd cuddled her. So that was another instance. So I got to the stage where I thought, do you know what? Plus, well, then the lockdown eased. So then I thought, right, my teaching's picking up, I'll be fine. I can go into nursing homes and care homes, residential, because I still had apprentices. I've got apprentices. Well, actually, I finished them now because I worked really hard in the summer. But then, of course, I had to be part of the testing. I was meant to be part of the testing, but some homes let me in without that. But then I had several other elderly people who knew me. A lot of them knew me anyway, because I've got a good relationship with certain care homes in this area. So they were so pleased to see me. Well, it made me feel good. It was like, Nicky, I was so pleased to see you. So then they started talking to me and saying, this is awful. We're being kept prisoners. We're not allowed to see our family. I want to live until I die. And lots of things that really disturbed me, like, why couldn't they make the choice? Let them decide. So they're saying to me, well, why can't I go out? Why can't I see my family? Why can't I live? I am 90, whatever ages they were. If I died tomorrow, at least I've seen my family and I've cuddled them. I've seen my new grandchild. I had a lady in tears because she hadn't seen her great-grandson. And then they started visiting some places they could visit, but only in the garden. So they were outcasts. Or some places are building a pod. And so obviously in the winter you'll be able to sit in the pod. So, but they feel like they're completely ostracised and that they've got the plague or whatever. So what I'm finding is people are saying they want to live until they die. It's the quality of life for them. It's not how long can we keep them alive. They would rather take the risk, because they say to us, we've taken decisions all our lives. We lived from the Second World War. We saw what was going on in the Second World War. We saw that there was a real enemy out there. Well, we're being kept prisoner. I want to die seeing my family. So there were lots of things going on. So I thought really this was upsetting, and I found it really hard anyway. But that wasn't such a bad time, because at least the summer, You know, and I was getting out and still keeping my business. But now, of course, we had the second lockdown. So I've lost my business. I don't see that I'm ever going to pick it up again. But now I've decided that mental health is the only way that I can deal with what's going on, because a lot of them are under the Mental Health Act. So where I'm working now, which is yet a different trust, so that's 3 different trusts that I've worked for since March. Now, I worked a bit during first lockdown for them, but then when the staff came back from shielding, I couldn't work for them as much as the manager really liked me, said, "You've been amazing, thank you for everything you've done, but you're not an RMN, so you can't work for us." So I'm like, but I was good enough to run your shifts when you were all shielding. Anyway, so I thought, fine, that's all right, I'll find another job. But then they came back to me, because now the manager she's very poorly. So I can work again. So I can work for them again. So I'm like, okay then, double standards, but it suits me, because actually I like mental health and I've learnt a lot. So these people are under section, so they're not allowed out anyway, but they were at least going out for coffees and stuff before each lockdown. But that was another thing that happened. First, in April, 4 of the mental health that are in a secure unit died from frailties, and they had abused their bodies. So some of them were drug addicts. There were many, many underlying problems. They were frail. They actually died, but they were put down on the death certificates as COVIDs, because they had no family members to actually stand up and say, "Oh, hang on a minute, this isn't right." So they were taken away in full hashmats. The undertakers came in, and the coroner we informed, but the coroner didn't come and see them. So I found that very odd, because I hadn't even had a test. Testing wasn't up and running by then. So that was another thing. But I just don't feel I can be a nurse anymore, because we've lost the compassion, the empathy, the sensory losses as it is. Cannot see us properly. And I know a young nurse said to me, "Well, you can smile with your eyes." And I thought, well, yeah, okay, fine, but not the same extent as a smile. And when you smile at someone, it heals so much. So what I'm finding, it's my experience as a nurse, all the things that I valued, that I feel is part of the holistic, whatever you like to call it, the whole person, caring for someone, it's not there. The things that we were trained, and the things that we have mandatory training on now, we have mandatory training on the Mental Capacity Act. We have on choice, dignity. It's all gone out the window. Human rights. So if somebody wants to see their family, let them live. Let them make that decision. If they want to take the risk, let them. When on the government it says, Whitty and the other person, they say, protect the NHS. I won't have any of that, because the NHS is there to protect the public. We are there to serve the public. What I've seen is we're no busier than any other time. We always work hard. And this clapping for the NHS, when all that started, I thought, yeah, okay, that's very nice. But never before have we had that. It felt false, because actually we're doing a job. So, and nurses have got gifts. They've even had GoFundMe pages. And there's lots of things happening that actually we weren't allowed to do when I started nursing. So it's as though our code of conduct has gone out of the window, because let's advertise and get lots of gifts. And I'm not saying that was quite nice to have gifts, but somehow it all seems very false, because now that all goodwill to all the nurses and all the TikTok videos that I don't quite know how they had time to do if they were really busy, it's all gone now, because people are not quite feeling the same way, I feel. But I'm actually ashamed to be a nurse, if I'm honest. I now do not want to admit to anyone that I'm a nurse, because it makes a sham of everything I ever was, everything I ever did. If you can deprive people of things that heal their soul, then we've lost humanity. So I don't really know what I'm going to do, because I've got to earn money, and I can carry on perhaps for a while with the mental health, but then when they all come back to work, then I will have lost that as well. And if you speak out, I'm not going to have a vaccine. It's not because I'm anti-vax. It's because I just don't see why you would have a vaccine for something that is you're very unlikely to get. I've never had the flu vaccine. I think your own immune systems are very strong. And yes, nurses always wash their hands a lot. But I'm very concerned about the instilled fear in young people about that they've got to gel their hands. What about their natural bacteria? Wearing masks, you're breathing in the same air, and we have our own immune system in our nose. We have our own cilia. It's as though everything that I've ever known has been destroyed. We did wear masks at certain times, but only when we had people that we knew had something very infectious. So I'm struggling with it all, and I cannot get that man 40 years old, and look, I don't know where he got sepsis from, but to die without his wife and his 14 and 12-year-old son and daughter, what's going to happen to them in the future? The man is out of misery, but what about his wife and children and their memories of their dad? The fact that I felt that I couldn't, well, I wasn't allowed to let them in, but I felt that I'd let him down. So I've got all of that guilt. So there's lots of things that I'm struggling with. So the only way that I can deal with it is to leave nursing, which is sad for me because I have enjoyed it, but I don't enjoy it now. It's a sense of dread because I cannot interact with people properly. My cognitive sensory losses, they can't hear you properly, they watch your face. So you've got this thing on that prevents them from seeing your smile that lights up, and they smile at you, but they can't get your body language. I know that you've got your other things, your body language is, we communicate probably 70 to 80% of us body language, but we're not supposed to cuddle them, we're not supposed to touch them unless we have to, and it's obviously all with gloves on. And I'm afraid I will do that. If someone wants a cuddle, I'm going to give them a cuddle. So that's how I feel. So I'm demoralised, I'm distressed, I can't sleep, I can't rest. I'm so wound up about what's happening, and I just feel very very bad when you think of all the years we've seen some horrendous things over the years. I mean, we've nursed all sorts of patients, and that was our job. We didn't expect anyone to clap for us, but at least their family could be with them. They would have the choice if they wanted to self-discharge, if they wanted to take different treatments. People that we're seeing have come in late to treatment because they don't want to overload the NHS, so they've been brainwashed, so they've kept at home, they've stayed at home with their condition. People have died from lack of treatment because they don't want to overwork the NHS. I mean, we've forgotten that everyone else, people die from other things. Where are all the other deaths? All we hear is it's COVID. If you've been tested within 28 days. But the thing is, it's not an accurate test. A lot of people don't even know they've had it. I've had my antibodies done at a certain trust. I've had COVID. I wasn't even ill. So I'm like, well, what? So I'm just, I don't know where it's, I'm sorry, I don't know where it's all going, and I can't carry on like this. So I have to give up nursing. And I feel it's a terrible end to a distinguished career. And I'm a brilliant nurse. I will say I'm a brilliant nurse, which looks a bit cocky. But I know that people have far more needs than physical. They have their emotional needs, they have to be nurtured, they have spiritual, what's important to them, whether it's nature, whether it's their family, whether it's music. So all of their end-of-life plans have gone out the window. So all the things that I did in my end-of-life course was to discuss their end-of-life care plan with them. What would you like at the end? None of that's happening. They've said, I want my family with me. I don't know. Now that I know they've put steps in that you can go in, one can go in with PPE on, but that's not the same as having flesh and blood next to you, your own kin. I don't know. Nursing homes, I really worry about that because there's a big rights for residents movement, and they are now fighting. You know, some people haven't seen their relative for 9 months or longer, and then Chris Whitty's saying if you see Granny at Christmas, then expect to bury her in January. I mean, what sort of blackmail is that? That's what he says. So we've got all of that psychological. You've got your elderly saying, I want to live until I die, but not wanting to put a burden and not thinking that they might spread it to their relatives. You've got relatives saying, oh, I better not go in and see because I don't want to put them at risk. But no one's communicating because actually they want the risk because they want to live and have some fun. So I don't know, but I cannot live a lie. So I've got to be true to myself from now on. And I know people say you're lucky you haven't looked after a COVID. I admit that. I'm not saying we haven't had a COVID, but I've looked after everything else that's end of life, like it always has been. And I cannot stand by. Well, I cannot be part of that. So I've had to make the decision that if I get told I can't work anymore, and the NHS threaten me with whatever, because I think that will come if we don't have our COVID vaccinations, then I will have to say, right, sorry, that's it. But I've written to the the Nursing and Midwifery Council. I've written to everyone, the Royal College of Nursing. I've said I cannot be party to this. I've said, look at the suffering that's going on, and not one reply. I've tried to get social workers when I've been at work with my mental health. We have safeguarding issues. I can't even get hold of a social worker. I mean, where's everybody else is working? Why? You know, we're still working and doing our best, but all the things that we had to report are not being followed up on now. So, anyway, I don't know if I can't, have I talked too much? Is that what you thought, or? Because I don't know. Cause
you've just done the most amazing tour de force. You've put the whole thing in context. You've not skipped a beat. You've done absolutely brilliantly. I haven't even needed to ask any questions. It's absolutely brilliant.
But I can't. You see, the trouble is I can't name the trusts. I mean, I can tell you, but I can't because they'll have me.
Let's pause it for a minute.